Hello, today we're gonna talk about LGBTQ plus youth mental health. LGBTQ youth mental health is a critical and increasingly visible public health concern. These young individuals often face compounding challenges stemming from societal stigma, rejection, and identity biases, discrimination that deeply affects their psychological well-being. The consequences are measurable and stark. Elevated levels of depression, anxiety, and suicidal problems compared to their heterosexual peers. At the heart of these issues is the intersection between self-identity and societal bias. When youth are not affirmed in their gender or sexual identity, it can lead to internalized shame, chronic stress, and emotional distress. In this intersection, there are many health crises. By opening with this context, we underscore the need for culturally component and affirming mental health care tailored specifically to LGBTQ plus youth. This presentation aims to outline the scope, risk, and most important, the paths to resilience and recovery. Project No Judgment Zone takes this mission seriously, advocating for visibility, acceptance, and action. LGBTQ plus youth experience mental health disorders at far greater rates than their heterosexual and other peers. According to survey, such as the Trevor Project 2022 national survey, over 70% of LGBTQ plus youth and more than 80% of transgender and non-binary youth report symptoms of major depression. Anxiety is another widespread issue. More than three-quarters of LGBTQ plus youth reported symptoms consistent with generalized anxiety disorder. This number underscores a systematic problem that transcends individual experiences, one rooted in social rejection, discrimination, and lack of access to affirming mental health care. Additionally, trauma plays a significant role. PTSD-like symptoms are reported by a large portion of youth who have endured bullying, family rejection, and conversion therapy. These statistics drive the urgency behind initiatives like No Judgment Zone project. Suicide risk and attempt rates. The statistics around suicide risk among LGBTQ plus youth are deeply troubling and demand immediate attention. LGBTQ plus youth are more than 4 times as likely to attempt suicide compared to their cisgender or heterosexual peers. This disparity is even more pronounced among transgender and non-binary youth, with over half seriously considered suicide in the past years, and significant proportion making an attempt. These figures are not simply numbers. They represent lives impacted by systemic neglect, alienation, and trauma. It is vital to understand that this crisis is preventable. Research constantly shows that family acceptance, supportive school environments, and access to affirming mental health can dramatically reduce suicide risk. No Judgment Zone, for example, aims not only to raise awareness but also to foster protective networks and environments that can help save lives. By understanding the risk, we can advocate for necessary interventions that offer hope and support for LGBTQ plus youth. Minority stress model. The minority stress model provides a comprehensive framework for understanding why LGBTQ plus youth are at such highlighted risk for mental health challenges. At its core, this model points that ongoing exposure to stigma, discrimination, and prejudice results in chronic cumulative stress that compounds existing vulnerabilities. One significant consequence is internalizing homophobia or transphobia, where societal messages and rejections are turned inward, diminishing self-worth and reinforcing shame. Another key factor is identity concealment. Many LGBTQ plus youth feel unsafe expressing their true selves in their homes, schools, or communities, leading to emotional superstition, anxiety, and societal withdrawal. Those stressors are not inherent to being LGBTQ+, but are imposed by hostile social environments. Addressing them requires both systemic challenge and culturally component support structures. Barriers to care. Even when LGBTQ plus youth seek help, they often face formidable barriers that prevent access to effective and affirming care. A significant number live in religions where LGBTQ plus component mental health provides are not available or where legal barriers like parental consent laws make it difficult to obtain services without risking outing themselves. Financial constraints are another pressing issue. Many LGBTQ plus youth, particularly those rejected by family or living independently, lack insurance or means to pay for therapy. Then those who do access care often encounter providers who are not adequately trained in LGBTQ plus issues, leading to misdiagnosis, stigmatizing attitudes, or ineffective treatment. Breaking down these barriers is essential to any mental health strategy. COVID-19 and anti-trans laws. The dual pressures of the COVID-19 pandemic and the rise of anti-LGBTQ plus legislations have created a compounding crisis for LGBTQ plus youth. During lockdowns, many youth people were confined to homes where they felt unsafe or unsupported, losing access to peer networks, school counselors, and LGBTQ plus affirming spaces. Simultaneously, 2023 saw a record wave of anti-LGBTQ plus legislations, more than 500 billion introduced across the US, many specifically targeting transgender youth. This includes bans on gender affirming care, restrictions on participation in sports, and limitations on class discussions. The psychological toll is severe, driving in crisis in anxiety, depression, and hopelessness. Efforts like No Judgment Zone are more vital than ever. So, protective factors and support strategies. Despite the significant risk There are well-documented protective factors that can greatly improve mental health outcomes for LGBTQ plus youth. Foremost among these is family acceptance. When youth are supported at home, the risk of suicide, depression, and anxiety drops dramatically by as much as 50% according to studies. Supportive schools and peer networks also play a crucial role. Environments that validate and affirms a young person's identity provide a safe space and growth and self-expression, which are essentially to healthy development. Policies like inclusive dress codes, gender-neutral restrooms, and anti-bully protections can make a profound differences. Equal vital is access to gender-affirming care. Online harassment versus peer support. For LGBTQ plus youth, the internet is both a lifeline and a minefield. On one hand, many face near constant exposure to cyberbullying, hate speech, and even targeted doxing. These online attacks contribute significantly to anxiety, depression, and feeling of isolation, offer mirroring and amplifying offline discrimination. Yet, amid the toxicity of this exists tremendous power in online peer support. Virtual spaces, including private forums, youth-focused platforms, and activist communities, provide validation, safer um, and resources. These digital sanctuaries allow for identity exploration and the formation of authentic connections, often inaccessible in their offline lives. Balancing these dual realities is critical. Crisis services and lifelines. Crisis intervention services play an essential role in protecting the mental health and safety of LGBTQ plus youth. Chief among them is Trevor Project, a pioneering organization that offers 24/7 crisis support through phone, text, and chat services, especially tailored for LGBTQ plus individuals under 25 years old. These services are more than just hotlines. They offer offer anonymity, empathy, and affirmation. When youth may be unable to find support somewhere else. Importantly, they bypass traditional barriers to access, like cost or needing personal permission. In addition to crisis responses, the Trevor Project provides rich resources like toolkits, guides, forums that help LGBTQ plus youth and their allies navigate mental health challenges. Call to action. A strong call to action is essential to move from awareness to impact. Schools must be equipped with inclusive curricula, clear anti-discrimination policies, and train staff capable of affirming LGBTQ plus students. The classroom can become a life-affirming space when students see their identities respected and represented. Healthcare must be explained not only in availability but in cultural components. This means training providers, removing gatekeeping mechanisms such as parental consent and subsidizing care for vulnerable youth. Policymakers also play a critical role. Laws must protect, not punish LGBTQ plus youth. LGBTQ youth in schools. Schools can be either sanctuaries or battlegrounds for LGBTQ plus youth. Evidence shows that inclusive policies such as comprehensive anti-bullying protection, gender-neutral facilities, and LGBTQ plus history integration um, correlate with lower rates of mental distress and absenteeism. Gay straight access (GCA) have emerged as key peer-led mechanisms of support. Schools with active GSA report significantly better mental health outcomes for LGBTQ plus students, including reduced suicidal uh, um, ideational and increased sense of belonging. Equality is important in training. Educators who understand how to support LGBTQ plus youth by affirming names, pronouns, addressing harassment, and creating inclusive lesson plans can radically improve school climate. Intersectionality and mental health. Mental health outcomes for LGBTQ plus youth cannot be fully understood without examining the role of intersectionality. Young people who also identify as Black, Indigenous, or people of color, disabled, undocumented, or come from religious minorities experience unique forms of marginalization that compound mental distress. These youth are often more vulnerable to systemic violence, including police brutality, housing insecurity, and healthcare discrimination, which worsen their psychological burden. For example, Black transgender youth face highest rates of suicidal problems in the US, a tragic result of racism and transphobia combined. To be effective, mental health support must reflect these intersections. Religious and cultural challenges. For many LGBTQ plus, religion and culture are integral parts of identity, but often sources of profound conflict. Faith community can offer belonging and meaning, yet they may also deliver messages that condemn LGBTQ plus identities. This creates spiritual trauma and shame. It may, in many cultural contexts, the issue goes beyond theology. LGBTQ plus subjects are often taboo, invisible in public discourse, and stigmatized with families. Youth navigating these silences face compounded isolations and fear of rejections. Yet there's hope. Um, in interfaith and cultural grounded LGBTQ plus advocacy is growing worldwide. The role of social media. Social media is a double-edged sword in the lives of LGBTQ plus youth. On one hand, it offers unprecedented access to visibility, role models, and affirming community, especially for those in unsupportive offline environments. Youth use platforms like TikTok, Instagram, and Reddit to find language for their identity, share art, and build friendships. But the risks are real. Algorithms frequently expose users to hate speech, misinformation, and toxic beauty standards. For LGBTQ plus youth already vulnerable to self-esteem issues or trauma, these digital harms can worsen anxiety and depression. A forward-looking approach must include digital literacy. Case study: the Trevor Project. The Trevor Project is the largest suicide prevention and crisis intervention organization, specifically serving LGBTQ+ youth. Its model demonstrates how integrated services from digital crisis lines to data-driven outreach can radically reduce risk and build resilience in vulnerable populations. Annually, it engages over 1.8 million youth across all 50 states. Its trained crisis counselors are available 24/7 and deliver evidence-based support. These organizations also um, uh, leverages its research to influence policy and public awareness, making it not only a crisis responder, but also a change maker in the broader mental health ecosystem. This case study underlines what possible when care is affirming, immediate, and backed by data.